Hi, I'm Kathryn Jean Lopez from the National Review Institute, and I'm so happy to welcome you on behalf of both NRI and the Catholic Information Center in Washington, D.C. And I'm so happy to be joined by Charles Camosy from Fordham University and the author of the Throwaway Society, among other books, who's going to unmute himself right now, and Sister Constance Veit from the Little Sisters of the Poor, also in Washington, D.C. And we're here to talk about the issue that both of these people spend so much time on. It's Sister Constance's life, and that's end of life care and ethics and really Christianity. Particularly in light of the coronavirus pandemic, and we've seen so much death, and some of it's been unnecessary. And so we're going to talk a little bit about that. We're also going to talk about, I think that one of the mercies of this time, where we've seen so many challenges and there's been so much fear and insecurity and all of these things, is an opportunity to rethink some of what we've been doing. As Charlie will talk about, no doubt, we've had in some states, including my own New York State, government orders that have that really resulted in the deaths of people in nursing homes unnecessarily. We got to ask ourselves, can we do better than making our elderly go to all these nursing homes? And of course, sometimes this assistance is necessary. That's why it's such a blessing that Sister Constance and the Little Sisters of the Poor exist. I've spent time at the Little Sisters home in Washington, and there is such love there. The people who live there are so loved, and you just see the joy. Obviously, growing old can be very, very difficult. We all experience it, wherever we are. Things don't work quite as well as they used to. You can't stay up as long, these things. But obviously, the older you get and the more health challenges you have, the harder it is. And yet, Sister Constance, when people are around the Little Sisters of the Poor, they really do radiate, the love of God that they receive and that they can then give. So anyhow, with that, Sister Constance, will you start us out talking a little bit about your experiences during this time? And the Little Sisters of the Poor, of course, serve the elderly poor, as I think if you didn't know before 2 Supreme Court cases, you might know now. What has been your experience like, and what are some of the lessons that you've learned that you think we all should take under consideration as we go forward?
Well, Kathryn, thank you for having me tonight. It's always a pleasure to talk to you, whether it's in front of a live audience or just the two of us. It's hard to believe that it's almost a year since this all started. And looking back on that time, I think that there was definitely a first phase, and then I'll call the second phase the long haul. The first phase was characterized by a lot of fear and anxiety, a lot of unknown factors. And I think that was in large part a cause of the fear and anxiety. It was a very acute situation. And, we're going into we went into lockdown in our houses by mid-March. I would say by St. Patrick's Day, we canceled our St. Patrick's Day celebrations. We were not taking any more visitors into the house. And not long after that, we were going into real lockdown where our elderly residents had to be isolated in their rooms. About that same time, the first of we have 24 houses across the United States, and the first one experienced an outbreak. It was in Newark, Delaware. And so I was asked to go there and help, and ended up staying for 2 months. I thought that I might be staying for 2 weeks, but I also thought, looking back on it, I know it sounds melodramatic now, but I thought I might be going to my death because it all seemed so lethal and so scary. But I was asked to go and help. I'm like, okay, this is my vocation. This is a moment of great need. I felt honored to have been asked. And so I went up there. I must say it was on short notice, so I didn't really put my affairs in my office in order. So I knew it was going to be a mess if I didn't make it back. But, I went up there, and there was a lot of fear and a lot of, I think I could say, like, extreme reactions to things, like extreme precautions, which I think were necessary, but I think some of it, we were in uncharted waters. So we had 11 deaths in that home. And at the same time that I was up there, we started having deaths in DC, which, the people in DC I know very well. So I was missing the deaths of all the people that I know. By Easter, for us in these two houses where I experienced it directly, the deaths kind of had come to an end. And then we entered, I would say, into the long haul period where we just have to keep following all the rules. We went into a phase of getting tested weekly. We're still in that phase. Depending on the results from week to week, we, like here in DC, I've been back since the end of May. So for the most part, we've been opening up gradually. We had not yet gotten to the point of being able to have inside visitors for our residents, but they were able to leave their rooms. And then 2 days before Christmas, we had 3 positive tests in the house. They had to go back into room isolation. They just came out the day of the inauguration. And we also got our first vaccine last week. So it has become somewhat routine. We go for our testing every week. We kind of live in anxiety. We go on Mondays here. So we live in anxiety for Monday, Tuesday, and usually by Wednesday around noon, we know what the result's going to be. And so, we're just careful. All the hand washing, the wearing masks, it's just become second nature. Yeah. And I have to say, though, through all of it, the elderly have been extremely patient, long-suffering, and resilient. And that has been a beautiful lesson for me to learn, to see, I think they're capable of taking the long view more than some of us. Most of the residents in our homes are in their 80s and 90s, so they've been through World War II. They've been through harder times than this. So they take everything in stride, and that has helped us a lot as well.
Well, there's a woman you introduced me to, we were talking about the other day, Anne, right?
Yes.
Who is 102?
I believe she's 102 now, yeah.
When you had me there, and first of all, you were even more cautious than you remember, because I was going to visit in very, very early March, and you had stopped letting any visitors come in. Which at the time, I thought, well, that seems super cautious. I don't know what they think's coming here. It's in China, but you're being very careful. But about a year ago now, actually, it was this week.
Yeah, you were here around the 1st of July.
Right, exactly. So you had me over talking about the year with the Mystics book,
yes,
and that I did, and oh my goodness. Your residents are amazing, prayerful people. I mean, it's just a powerhouse of prayer. And some of the things that some of the people there said to me were just like from the mouth of God. It was amazing. There's really something special about your houses, no question about it. And I also want to underscore, you're not being melodramatic. That was really a beautiful self-sacrificial thing you did to go into this terrible unknown that you already knew was a bad situation. And so thank you. We're going to come back.
It ended up not being as bad as my fears, but you don't know until you're in it how bad it's going to be.
Right. And it was like if somebody decided, hey, in April, maybe I'll move to New York City. Who in their right mind would do that? Everybody was fleeing, myself included. Charlie, so you have been writing about this, talking about this seemingly nonstop since before most of us realized it was a problem. And one of the things that you started talking about very early on and trying to help doctors and other medical personnel with is, let's not ration healthcare, choose who's worth saving or not. Obviously prudent decisions need to be made when you have limited resources, but you've been a conscience really for medicine, for media, for human beings, And so talk a little bit about your experience and insights, lessons from this, and biggest maybe concerns and also hopes, if that's enough to talk about.
Yeah, well, give me 2 minutes. First of all, thank you for inviting me, Kalo, and Sister Constance. It's a honor to be with you on this call. I have to say, it's one thing for a professor to pontificate on these things. It's quite another to actually dive into the fray as you've done. What an amazing start to this event by hearing that story. It reminds me actually of, Kathryn, if you don't mind my mentioning our previous conversation where I thought it would be important to mention Rodney Stark's book, The Triumph of Christianity, where he goes through and shows from his point of view historically how it was the church's response to pandemics that actually was at least partially responsible for its growth, the early church's growth. And he looks actually at gravestones and whether they had Christian markers on them before pandemics and afters, and shows that there's more after. So it's not an airtight argument, but it's so interesting. And I have to say, the church has been uneven, let's say, in its response, in my view, to the pandemic, but not the Little Sisters. Thank God for you. And thank God for them in particular, because they show us how to live out what I like to call, what Pope Francis calls, a culture of encounter and solidarity and hospitality. Even in this very difficult time. But that's what I think the pandemic revealed. In some ways, the pandemic has done us a favor because it's highlighted how throwaway culture was functioning with this population even before. So sure, our illustrious governor here in New York, essentially started a COVID fire in nursing homes by putting COVID positive patients back into nursing homes in ways that were unconscionable. And that's its own problem of the pandemic. But it must be said that what actually has been revealed about how we warehouse and leave old people to die, it was I guess could have been widely known, but just wasn't focused on, maybe is a better way of talking about it. The pandemic, I think, has helped us focus on this. And what we've learned is not pretty. And not every place is like a Little Sisters of the Poorhouse, of course. In fact, I was just looking for this article I saw yesterday in Skilled Nursing News, the headline of which is, "As lawmakers mull nursing home reform, how do we fix a system that's seen as a fate worse than death?" Question mark. That's not true, of course, of every nursing home or every care home, but it is true of a number of them, more than we should. The church does a better job than most. In fact, I got a nice email from the head of Catholic Charities after I wrote a piece in the New York Times saying, "Hey, we do this really well and you should write about us." And that's true. And so there are good places. But one of the things we learned is that quite apart from COVID, actually, a very large number of people died in nursing homes, just a straight up no chaser neglect. And the AP did an amazing, actually, investigative report of this. I encourage any of you to look it up. Politico also looked in particular at how people with dementia fared during the pandemic, both inside and outside of nursing homes. They found that 12,000 more people with dementia died, not of COVID, just died, period, this summer than the previous summer. And we don't totally know why, but I think we can make some strong guesses that this is also likely due to some kind of neglect, which we might attribute to throwaway culture. And it's going to get worse from here. I think I'll finish with these 2 points. The numbers of people with dementia are going to explode over the next several years, especially as people get older. And there doesn't seem to be a cure on the horizon for this kind of thing. And so there seem to be 2 different options we can take. One of them is really, really bad. And that's the increase in the temptation to use physician-assisted suicide as a way through these kinds of issues. In fact, during the pandemic, it was so interesting and heartbreaking to see. Maybe some of you saw the case in the Netherlands of the person who had requested physician-assisted suicide before she had late-stage dementia. And then once she had it, she said 3 different times she did not want to go through with the physician-assisted suicide. And her doctor went through with it anyway. And then the doctor was put up on charges, or there was a legal process to see if she would be put up on charges, and she was not charged with anything. So I can really see a future. It's not too hard, in fact, to envision a future where if you see this as a fate worse than death, and you see being warehoused in this place where you don't have anything like what the Little Sisters offer, that maybe this could be something you'd think, well, this is not what I want, but I can't imagine this other thing, this other fate coming my way. The other thing, which is only slightly less better in my view, is, and it may sound futuristic, but I don't think we should think of it as futuristic, is what I call the slouch towards robots. I think we're going to look at this population as a throwaway population and go either one direction or the other, based on where we are right now. There are alternatives, of course. We can live out what the sisters are doing, but if nothing is done, I think really those are the two ways we're going to go. If what's been revealed during the pandemic is indicative of what's going to happen in the future.
Well, Charlie, I think too, when Cuomo did what he did, there's an ideological consistency to what he did. And that's one of the things I found most alarming. I don't think he said, let's kill elderly people with COVID, but I do think they would be less of a priority. That is logically consistent with someone who had already vowed to bring assisted suicide to New York.
Yeah, that's one of the things that disability rights groups, along with pro-lifers, say every time that this is brought up is once you start giving reasons for why, hey, it might be, we could kind of understand why you over there would want to kill yourself. You send a not so subtle message about what kind of life is valuable, or what kind of lives, maybe a better, more precise way of saying it is what kind of lives are more valuable than other lives. And it just became a situation, and Cuomo was not the only one. In fact, I think he probably, if we want to give him the benefit of the doubt, took some really bad advice from a medical director or something, because what the concern was that they needed to keep the hospitals open, right? And not full. Of course, to great fanfare, there was the Mercy ship that came in, and they had the convention center open. They never used any of those spaces, but yet they still under the pretense of trying to keep hospital space open, like I said, lit a wildfire of infection in nursing homes. And I think there was a sense like, well, there had to be at least an implicit sense that those lives didn't matter as much as the lives that would be presumably affected by having the hospitals full. Right.
As a sidebar, you mentioned throwaway society, and this morning I actually took a picture of, it amazes me the amount of trash that we accumulate. And I've never told you this before, I'm pretty sure, Charlie, but every time I see garbage, I think of you talking about the throwaway society. That's lovely. And I couldn't send you the picture because I hate sharing anything ugly, but it reminds me of the importance of, trash is one thing, right? But why are we using all this stuff? And it's all wrapped up, right? There are elements that are more important, obviously, than others, but we need to start thinking differently. Sister Constance, can you remind me, there was that lovely priest who lived in your home, who died early on because he had so many health problems. Mm-hmm. Can you tell the audience a little bit about him? I remember when I met him, I was just so moved by his story. A Black Catholic priest, yes, who, I'm going to butcher the story, so you tell it.
Okay, well, Father Charles Green was an African-American priest in the Archdiocese of Washington. He was a late vocation. I believe he might have had 25 years or 30 years of ordination. He had multiple health problems. He was an amputee and had to go for dialysis 3 times a week, but he really had a strong desire to live. And he tried to carry out his priestly ministry during his long hours in dialysis. He told us the story that, he was a delayed vocation because he was a native of DC, grew up in DC, never saw a Black priest, and so it never occurred to him that he could become a priest. He was a lifelong Catholic, and it was working in Charles Manor, Carroll Manor, which is a long-term care facility run by the Daughters of Charity as part of Providence Hospital, which has closed now, but Carroll Manor is still open. He was assigned as an orderly to take care of elderly priests. And it was elderly priests who opened his eyes to the possibility of a vocation. But he was very beloved here. He helped various residents and a few employees come back to the church. But in a sense, he was like a sitting duck for COVID because, he couldn't survive without going to dialysis 3 times a week. And so in a sense, it was probably only a matter of time. And he was one of the early residents who died. And he died in the hospital, unfortunately, because when he would, it's always a danger of anybody on dialysis is acquired infections. And so, he came home with a temp, he had to be transported to the hospital, and then he was never able to come back. But he was a lovely person, a really lovely person. Everybody misses him.
I only got to spend a little time with him, but I was horrified in a sense when he told me he thought he couldn't be a priest because he was Black. And but what joy he was not bitter about that at all.
No.
And I remember him telling me how it really bugged him that there would be like these Catholic university girls who would come over and volunteer, but none of them went to church. And so he tried to like charm them into going back to the faith of their parents, And anyway, I thought he deserved a mention because he's an example of the kind of people who one would meet in your home if it was normal times.
Yeah, the sad thing was, like, he was very beloved. His former parishioners still came and celebrated his birthday with him every year with an outdoor mass that he would celebrate and a picnic. And, because of the precautions that were required in the early months of COVID, he passed away. He had a very, how should I say, off the beaten track funeral. I think he did have a funeral, but certainly all those who loved him were not able to go to it and to, celebrate his life and have closure. That was another hard part of the whole thing in the early months, was the lack of closure for those who were dying, for their families, for other people they left behind. Was tough. It was just like, well, they're gone,
Right.
Yeah.
And we were well, Charlie, you mentioned earlier, the unevenness in the church response. There was a time where you were hard pressed to be able to get, and this was the church, the hospitals too, get priests into hospitals to give people, to anoint people. I've heard that's a problem still some places. But Sister Constance was talking yesterday when we were having a phone call about tonight. There were groups of priests who, in the Archdiocese of Boston, for instance, I know a Dominican who they isolated themselves, and this was going to be their job. They were going to go in and anoint COVID patients, so they wouldn't infect anybody else. This would be what they do, and thanks be to God for that. But it seemed few and far between. I hope the more time passes, we'll find out more about the good stories, but there were definitely some really terrible situations.
Well, and I think Kathryn, so I found articles about the Archdiocese of New York. I forgot about that one yesterday. Boston, St. Paul, Minneapolis, and then a story from Rome. But I would hope that the experiences of those pastoral teams, those teams of priests, like the article from Boston was written in October, and as of October anyway, none of the priests who served in this capacity had contracted COVID, and they also hadn't been responsible for giving anybody COVID. So I would hope that if this continues, God forbid, that those experiences could be instructive for the bigger picture, that there are ways to still go in and safely minister to people. I would hope that we're over this fear of the unknown, very extreme response phase, and can step back a little bit and think some of these things through and realize, we don't, have to be as drastic about some things, that there are safe ways to meet the spiritual needs of Catholics and, most likely other believers, of other faiths, that there are ways around of, training. These priests were really well trained. They were well supplied with PPE. They had very specific procedures, like there's a video from the priest in Boston showing how he would prepare Q-tips ahead of time with the oil of anointing into plastic bags, and he had the anointing prayers on little pieces of paper, because everything he brought into a room would have to be disposed of after. So they showed that where there's a will and some intelligence, there's a way. And so hopefully, if this does go on for much longer, that others can learn from those examples and be ministering to people more actively than we saw in the past 10 months.
Charlie, I think some of another way that COVID has been a mercy maybe is it's exposed our unbelief in some respects, in particular the fact that we kind of, at first we had no idea what we were dealing with. I think the church was good citizen to say, obligation lifted for Mass on Sunday, right? But it went on too long. And I hope there's not a comfort level with watching Mass on Zoom, and like Sister Constance was saying, I mean, when I go to Mass, I'm nowhere near anybody, we're taking precautions. But the fact of the matter is people need their spiritual needs taken care of too. And the idea, it horrifies me that liquor stores are open and churches aren't, it's like you're begging for people to have addiction, right? And talking about suicide, assisted suicide, as we were earlier, there's been such an increase in suicide, calls to suicide hotlines, people thinking about how they'll kill themselves. The church needs to, and when I say the church, I'm not saying bishops go do this, I'm saying all of us, right? Need to rethink, and I know you're thinking a lot about this, rethink how we approach the world and our lives. And as we were saying before, even just how we care for our families. And this is related to a question that one of our viewers has asked. A culture of encounter to me reads as show up, just show up for the people in your life and community. COVID restrictions have seemingly made this impossible for so many, especially the elderly who are so desperately need people to show up for them. How do we actually weigh the risks of COVID versus the risks of neglect, loneliness, suicide? What can I, as an everyday citizen, do to help that goes beyond politics? Charlie, do you want to?
Like all really, really important questions, it's so complicated, and we could easily have a semester-long course trying to explore the different complexities there. So I'll just name a few things that might be helpful to begin to start thinking about that really, really important question. First is, we're not utilitarian. So we're not in the business of saying, well, let's add up all quality adjusted life years and do whatever maximize the number of quality adjusted life years we'll save in any given moment. That's what the NHS does actually in the UK, trying to figure out what they're going to do with various procedures and how they're going to spend money. But that's not especially what Christians do. We have a much more complex thing. It's not like a math problem for us. We have to balance certain goods. And obviously the good of life, as any pro-lifer will say, is, if not paramount, like about as important as we could possibly get. But there are other things we need to weigh, like Sister Constance. When she thought she was perhaps going to her death, she weighed the good of her life against the other good she was going to bring to those people she was serving. When priests, one of the most moving parts, I think we need to, so I hope somebody writes a book in English about how Northern Italy dealt with their pandemic at the very early part of this. There apparently were just a lot of priests who died in Northern Italy. And it's interesting to think about why. We don't necessarily know why, but again, if we use our common sense, apparently a lot of priests put themselves in situations where they got COVID and died. in northern Italy during the early stages of the pandemic. That's terrible. That's a tragedy. That should not be sought out or anything.
Right.
But yet it's something that I think is heroic and we should point to. These priests wanted, it wasn't just a horizontal set of goods. There were a vertical or eternal set of goods they were concerned about. And we should do everything we can. And the example Sister Constance named of these archdioceses that are doing it right, those should be replicated. We should not put priests in danger or put priests in a position to spread COVID. But at the same time, I think we need to acknowledge there are multiple kinds of goods here, as you mentioned. Another one that I think we need to call out is, and it's related, but it's slightly different, is how many people died alone during the pandemic. This was a big, big issue for me and for many others. Yes, I guess you could say if you were just doing a utilitarian calculation about spread, maybe you could shave a few tenths of a % off the chances that somebody would spread it if their family was allowed to say goodbye to them or something. But that's such a monstrously important good, right? To be able to say goodbye to your loved ones before you die. I just don't see how you even, I think it's a category mistake to have some kind of calculation about how that might work. And so again, we need to do things smartly. And if we do go through this again, as we go through this again, and there will be another pandemic, right? We should prepare for how we do this in the future safely. But just I mean, it just breaks my heart in two to think about how many people lost loved ones without being able to say goodbye to them. And again, we could have a semester-long course about how precisely this would work and how it would deal with public policy and religious freedom and all sorts of things. But let's get to that complex place instead of seeing it as, again, like a math problem or something that is fairly easy to deal with. It's not. It's simply not.
And when we talk about, there are different layers, there are different elements to all of this. When I say, this exposes our unbelief to some regard, there was an element where there was this extreme fear. And, what are we afraid of? Are we afraid of dying? That's a problem. We're all going to die. And I have friends, one of my best friends died on All Saints Day, and it wasn't COVID. It was leukemia. People have been dying of other things, So I think that's something that really needs to be an examination of conscience for us. Like, why were we in shutdown? Are we trying to escape death here? And I'm not saying, again, to be reckless or anything. But do we really believe that Christ died for our sins and was resurrected and there's eternal life, or do we not? And then the other question is, and I know you think about this a lot, Charlie, is do we have to just rethink so much? I mean, first of all, yes, are we taking care of our loved ones? I think a fundamental question, saints tell us is love, right? Jesus told us. I mean, so when you're weighing all those goods, love, I mean, the other thing about not being able to say goodbye, I've heard you, Sister Constance, before on panels with me talk about the amazing things that can happen in families at the end, right? And I've seen it in my own life, being at the bedside of someone dying, right? Just like miracles happen sometimes, not of healing in the health way, physical way, but in reconciliations and things.
Mm-hmm.
Could you just talk about that for a moment, Sister Constance?
Yes,
Especially looking forward.
Yeah, it's a tradition of my congregation, the Little Sisters, that under normal circumstances, we keep a 24-hour vigil with residents who are dying. So once we recognize that they've entered the dying stages, and I don't mean just like in the next hour, I mean, that death is imminent within a couple of days, say, we take turns to stay with them 24/7. And our staff come and go, other residents come and go in their rooms, and we allow the families to be there as much as they wish to be. And so that's, I would say, more often than conversions among the residents today. Back in the day, we hear stories about dramatic conversions of of the elderly who were like bank robbers and, were some pretty shady characters. But more often than not, it's conversions or reconciliations among the family members gathered at the deathbed. Often enough for the elderly, when they're dying, they would give the appearance of being asleep. More often than not, they get to a point where they're not fully conscious, and they're usually not in terrible dramatic pain like you see in movies or TV. They're just kind of slowly petering out. So they're not actively communicating, but the family is communicating, in the room. And sometimes they're asking us questions or staff members, and an awful lot of very rich, spiritually and emotionally laden sharing and encounter goes on. Talk about a culture of encounter in those hours and days. And, the very tragic thing about COVID was that, at least for many months, that was all eliminated. I saw in Delaware in those early days that the closest anybody could get was, through a phone, or there was one nursing unit there, one wing of rooms that are on the ground level, so families could come and try to peer in through the window. But the lighting was such, and the material of the windows, that you didn't see a whole lot, and the dying person couldn't really see out the window, the glare or whatever. And so that was pretty limited. So that was really difficult for the families, just, and even for us, it's part of closure for us as well, that we go through that whole process. When a person is very close to death, during the hours of day, we'll send out a call, and all the sisters will come to a room, and we'll sing and we'll pray. So we weren't doing that. We were having maybe one sister praying in the doorway when PPE. And so an elderly person might not have even been aware that she was there. Usually under non-COVID circumstances, we would be sitting at the bedside. There's a lot of touch that goes on, and all of that was, of course, impossible. So, those are the very important human elements. And, I just have to wonder, hindsight is 2020, right? So we did what we had to do in each circumstance. And as things were constantly evolving, and, our superior general consistently said to us, please do whatever the civil authorities are asking of you, whatever the health authorities are asking, do it. So we weren't going to, buck the system, so to speak, but hopefully going forward, there would be a greater understanding of each individual human being as a unity of body, mind, and spirit, and that it's not only a matter of treating the body, but also the spirit, and also that for each sick person, there's a circle of significant others, family or friends, surrounding them that also need to be considered, for sure.
I just want to say, as a not little sister of the poor, that I
Could
think
be.
I'm sorry?
You could be.
So, I think I'm more valuable to you, not there. I think there's a danger sometimes when we listen to someone like Sister Constance, who's on the front lines and who has given her life to God and this work, his people, to think, oh my goodness, that's so laudable, that's so amazing, she's a saint. And I'm not saying she's not a saint, but she's a human being who answered a call, and she has all the same struggles, obviously, within the context of a convent, that the rest of us have. And I think that's important, because she is our credibility, and more of us need to be not only talking about what they're doing, but supporting them in whatever way we can support them. If it's financially, if it's by being a writer who writes about them, or talks about them in these platforms. But this is a huge problem we have, and there are people who have dedicated their entire lives to being the solution, and we have to support them. And it's a problem if we don't support them. And there aren't young girls knocking down the door to do this work because it's not pretty work. But it's beautiful work if you look at it from who we are and who we're supposed to be. And so we should be encouraging girls to look into being a little sister of the poor. It's really important. And I think we've lost in our culture, in our Catholic culture, the encouragement of vocations like we used to. So anyway, thank you for what you do. But I
thank you,
want our
Kathryn.
audience to know that you're a human being and
Thank you
not
for the plug.
kind of saintly superhero.
But I would add that not that we've ever seen an influx of vocations after grandma or great grandma dies, but it is touching sometimes that some people who seem so far away from the practice of the faith are walls come down in these intense circumstances of accompanying a dying loved one. And, it's hard to put into words, but it's just like their hearts are opened in those. It's a very intense situation of grace. And so people who have been away from family, estranged from family and away from the church for many years, I can't say that, yes, they're completely turned around and it has a very lasting effect, but their hearts are opened. It doesn't take, it's not rocket science. It's just the love that they see. It's also very touching to families when they see how much their loved one was loved by the other residents, by the staff. And, I do think that there are lasting changes in people's hearts from experiencing, this life and death situation. And some of the best spokespersons for us have been the sons and daughters of residents who have passed away. And they're just so grateful for, they might not have been too attuned to the care of the dying or the elderly until it was their own loved one. And then it's a life-changing experience and they become great, long, lasting friends of ours. So that just goes to show that people's hearts are susceptible maybe of being opened, in these moments of grace.
Well, and what's striking to me too, I said earlier that what a powerhouse of prayer I've observed there, the prayers are largely for the conversion of their children.
Yes.
So it bears fruit sometimes during their lives because of God's work through you. Charlie, what are some of the thoughts that you have going forward about how we can do big things differently? I know you've even personally, thought about some big things you might be able to do that are not writing books. We need to be thinking that way.
Yeah. I mean, if I'm honest, halfway through the pandemic, I thought maybe I need to drop everything and open up a nursing home. Right.
Right. That's real.
I've had serious conversations with my pastor about a convent that is almost empty and what are we going to do with it? Are we going to lease it out and make some money? What are we going to do with it? And I've made a strong case that could we create and fundraise for a care home that actually created helped create a culture of encounter and hospitality, maybe over multiple generations. There's a school which also closed on our home parish grounds and is being leased out. I've even had some crazy ideas about could we have intergenerational interactions that the church would host, right? From people who are in need of caregiving or education on multiple levels. It's one of the great tragedies, of course, of the church, at least in several places in the United States, that we have a lot of these empty buildings. What can we do? How can we post-pandemic perhaps retool the buildings or make space for a culture of encounter and hospitality with respect to vulnerable populations? Those are big ideas. There are smaller things that all of us can do. We're one of the things we could do perhaps is And I'm guilty of this myself. I grew up in a little town in Wisconsin. I now live in New Jersey and work in New York. Maybe we don't always follow the call to adventure so far away from our families, right? Maybe there's a mixed blessing when your family encourages you to go anywhere and do anything and be anyone, which is a kind of a peculiarly American late 20th century kind of way of thinking about it. Maybe we ought to think, especially in an age, for better or for worse, of Zoom and YouTube, we can think more about staying in a particular place, in a particular area, and building and putting down roots and building up communities, so that even in our own homes, we can take care of our loved ones. Now, there are people who need specialty care at the end of life, of course, but one of the things I'm struck by is how many immigrants come to the United States and say, wait a minute, where are you going to put your mom and dad again? And like, how is this going to work? And you're never going to see them. And wait, you're moving across the country. You're going to pay someone else to take care of them. That's not what we do in my, so I don't know, maybe there's a moment here post-pandemic where we say we've kind of overturned the log, and what we've seen underneath the log is not good. We haven't really looked at it before, but now we're looking at it, and we make intentional choices both in our own personal lives, but also as a church.
And I think your big thinking is not crazy at all. I think Catholics need to be thinking more about, Catholic investors, there are properties that the church would love someone to take off their hands right now. Could investors get together and good Catholic people who happen to have money and start something? That the idea that the institutional church needs to do all of this shouldn't be, and it can't be sustained any longer, especially when you don't have sisters teaching in the schools anymore at the same level as they used to. That means money, right? That means healthcare. That means all these things. So there should be some big dreams here that people start to think about. There's a comment that I think is a great one. Going back to what you said about fearing death, I think there's an element of control that as people, we struggle to give up that control. And with COVID, we seemingly have some type of control over whether we can get exposed to this virus. And of course, I think people sort of were losing their minds a bit because they couldn't control, right? I wonder how much that plays into how we have responded to this pandemic, and that on a spiritual level, our church needs to reinforce that giving up control is good. Sister, you want to speak to that for a moment?
Well, when you spoke of that, I thought immediately of the Urbi and Orbi, the Holy Hour that our Holy Father had on March 27th, it was, right? And he spoke about that, about the illusion of being in control and how this has, forced us to realize that we're not in control. And like our lives are always in God's hands. I almost said ultimately, but they're always in God's hands. And it's just that we're not always thinking in those terms. The elderly do help us to be mindful of that. And I think one advantage of not pushing the seniors in your life away is to be close to them, and some of their wisdom can rub off on those of us who are younger. Like I've been engaging with seniors since I was 15 years old, and I just realized that they've really formed my perspective on so many things, and to see the long view and to just have a greater realization that our lives are in God's hands. And yes, we do what we should do. We follow common sense. But just as like I was driving from DC up to Delaware, thinking to myself, well, this could be my end. If that's what God's asking of me. Yeah, but just to be more aware of God's place in our lives. And I do think that, I think there's been fear, but I think for other people, they've grown in that awareness, and grown closer to the Lord. And I've talked to, people, whether they're our staff members or people I know from different walks of life, who have just become more aware of how precious life is. And how God is really in control in the end. I mean, in the day-to-day, it's nerve-wracking for us in a nursing home because, we can plan all we want, but when the test results come back every week, like I think my most devastated moment was December 23rd, 2 days before Christmas, and we're told everyone has to go back into lockdown. It was like unbelievable that this could happen. That was my worst scenario for Christmas, that we'd have the residents back in lockdown, and it came true. But life goes on, and you have to just go with the punches, and this too shall pass. If God gives the grace that you need at the moment, and like very much December 23rd, I really had a low point, and then I just said, okay, get over it. If you sit in your office and sulk, that's not going to do anybody any good over Christmas. Get out there and do what you can do.
Well, there is this real danger. I was very concerned as we approach the new year, the number of people who are saying 2021 will be over it, and all the talk of going back to normal. We shouldn't go back to normal. Just the other day, I had an overreaction to some big noise. I thought the building I was in was going to blow up or something. But the good thing about my being crazy was that I had the thought that I am not ready to die right now. And we have to be ready to die. If we're not ready to die, get yourselves a confession, which I did, and now I have to go again anyway. But we need to be prepared because we never know when the time will be. And so COVID should have us living differently. There's a very direct question that someone asked to help focus as we're about to wrap up. What is the biggest lesson the church and the state should take away from this pandemic, Charlie? There's a button that you should press that would give you the perfect answer to that question immediately.
It's the mute button. No.
Oh, it's a great gift as a professor, I have to say. No. I mean, at the risk of repeating something I've already said, I guess, let me build on what we were just talking about. My next book is coming out this summer, and it's focusing on how the secularization of medicine, which has had such a profound impact on the broader culture, on so many of these things, has really put our death denial into hyperdrive. Because of course, contemporary medicine, which is consumerist in nature and achieving on a horizontal scale in nature, doesn't really know what to do with death. When death comes, that's when you call, in the priest, right, or other person. That's when the physician leaves, right? That's when the physician goes away, and especially the specialists go away. And a denial of death and an intentional culture who pushes death to the margins outside of where we normally see death has led to so many of these problems. In fact, again, there will always be people who need specialized care that we won't be able to provide in the homes. But that one of the things that makes it possible for us to deny death is that we don't have it in our homes. We don't see people die at home. And I talked just some stories about my mother, and it was a common thing for people to die at home. And death was something that people experienced on a regular basis. They witnessed death. They saw dead bodies. They prayed. They had gatherings of family and friends on a regular basis. So I think there's real wisdom about not only treating people at home and keeping them in your space so that there can be a genuine culture of encounter along the lines we've already talked about. There's something just about facing the reality of death, both as a culture and as individuals, that I think would put us in a very different place, not just in our own, COVID related set of questions we've been doing this, but as Kayla mentioned, as human beings, as Christians who should be thinking about our death every day.
Well, and I'll add on the state issue. We made a very bad mistake when we allowed it to be kind of accepted that religion isn't as essential as going to the grocery store or some places there were crazy things, that acupuncture and nails, and would open up before church.
Tattoos.
Yeah. And so religion is essential. And for Catholics in particular have an obligation. Do we really believe in the real presence or not? I was crazy because I could not be present for the Mass. And I contend to this day, if you told me that I could be at Mass but not receive the Eucharist, I would sign up for that, because I needed to be present for the consecration. It's like, there's all this awful stuff happening in the world. I need to go to Jesus. If we believe in the real presence, virtual Mass doesn't cut it. And we have to make that clear. And I think that would be such an encouragement. And you don't do it in a negative kind of way, an encouragement to priests to know that the people really believe in the real presence. It might renew their own, belief in the real presence. So yeah, the religion is essential. And that will have so many different effects, I think, in our culture. And we have 4 minutes. So Sister Constance, biggest lesson from church, for the church or the state or both?
Well, if you don't mind, I would like to read part of a statement that
Sister,
Archbishop Thomas Wensky wrote. He was applauding the HHS Office of Civil Rights and Roger Severino, its director, for having resolved some lawsuits against a couple of medical centers. One was Mount Sinai in New York, and then MedStar Hospital System in Maryland, DC and Maryland. And there were lawsuits brought because clergy were not allowed into hospitals during COVID. And this is what he says, that Roger Severino and the OCR helped to resolve these cases. And he said, Jesus Christ, physician of our souls and bodies, gave us the sacraments to convey God's grace and healing. As Pope Francis has noted, the sacraments are Jesus Christ's presence in us. Without them, we're distanced from God, the source of our being and meaning. So it is of paramount importance that our government, public health authorities, and healthcare providers strive to respect the liberty of the faithful to receive the sacraments. Medical experts play a natural role in this COVID-19 effort, but must avoid treating physical interactions in religious exercise as unnecessary or unacceptable risks because they are religious. A true understanding of human well-being accounts, as Jesus did, for the health of both body and soul. And so I guess that would be my parting words, to have a greater understanding that a true understanding of human well-being accounts for the health of both body and soul.
Charlie, any last words?
Can I just leave it there? That was just perfect. That was just perfect.
Well, thank you everyone who joined us. Thank you to the Catholic Information Center for co-hosting this with the National Review Institute. I would recommend that you go to cicdc.org, nrinstitute.org. We've been trying at NRI, we've called it virus-free programming when we can't gather in person. And honestly, it actually has meant that we can reach out to more people than when you actually have to get people into seats, So there are some blessings in all of this, as much as we miss being able to meet in person. But please also follow the work that Charlie Camosy does. I don't recommend generally people going on Twitter, but if you go on Twitter and follow certain people, Charlie is one you should follow. Sister Constance, thank you for all of the work that the Little Sisters of the Poor. You've had to fight for religious liberty. You've had to save people's lives. Like, is there nothing we're not going to ask you to do?
Well, thank you for your support, Kathryn.
Well, thank you for what you do. And again, I recommend that you go to the Little Sisters of the Poor website and think about, pray about, is there some way you can help them, help support them financially or educating people. Hey, if you're on Facebook posting pictures of, your Zoom call today, why don't you post something about the Little Sisters of the Poor too? Maybe share this video,